But unfortunately, we aren't able to re-establish that connection with Zara in Syria. So let's talk now to Thomas Tighe, who is the President and CEO of Direct Relief, a non-profit humanitarian medical organisation. Thanks ever so much for coming on the programme. What is the latest that you're hearing from your teams on the ground?
Well, it tracks with what your reporters are saying. I think the search and rescue period, it's a time-limited window, and so as that changes, I think what emerges are the basic issues of food, water, shelter, sanitation, and we focus on the health and medical component, which your correspondent talked about. So we've mobilized the first 20 tons or so and trying to make sure it's the right material, that it's approved by the government. We've worked in Syria for years with the Syrian American Medical Society, that's the largest provider of health services in northwest Syria. So we've had good contact with them. Our folks are with their teams trying to mobilize and make sure that not only the material is right, but the logistics channels are open to get the material into Syria, as well as working with the teams in Turkey at the municipal level, the critical care facilities where a lot of the medevacs are going to make sure we can mobilize material either from the States or from Europe, which we do frequently. So it's an unfolding situation, but that's what we're doing at the moment.
Are there conversations yet happening about the support for trauma, for psychological damage for the people who have survived? I'm thinking of the many, many children who've lost family, who've been displaced. Or is that a conversation for later, once you've done this basic rescue and aid packages?
Well, I think it's on everyone's mind. It occurs a bit in the background, as you can imagine. I think that those who have can be saved, I think the critical care facilities that the medevacs are going to, they're stocked out as well. So I think for now it's an infusion of material to treat the wounded, as well as the chronically ill who've been displaced. You know, if you were managing a chronic condition like diabetes or hypertension and it becomes unmanaged, you too can find yourself in an acute health crisis. So everything that was bad before it still exists, and it's got a whole level of enormous need on top of it. So
according to the WHO, at least 60,000 people are reported injured. You've mentioned the hospitals that are overrun. I think 15 hospitals in Turkey are reported destroyed, though. Resources are needed desperately. I mean, how huge is the gap?
Well, we can stipulate it's huge. We don't know the full dimensions because the information is still a little spotty. I think that aggregation of all this need from multiple sites is a challenge, but we're doing the best we can in picking the municipal referral facilities, working with the Critical Care Society of Turkey, the people who run the ICUs, and they tend to have a very good sense of what's needed and what specific supplies can be obtained locally and what we can bring in from outside Turkey. So we're doing that as we speak and mobilizing a lot of material. I think the world wants to help, but we're also cognizant of how important it is to make sure it's the right material that gets to the right places in the hands of the right people who are trained to use it.
Well, I do hope you get all of the support you need. Thomas Tighe, President of Direct Relief, thank you very much.
Thank you.
Still ahead here on CGTN.